Hello everyone, I am Sheetal Kalra, Associate Professor, School of Physiotherapy, Delhi Pharmaceutical and Research University. At the outset, I would like to express my gratitude to Dr. Mudgil and Team HCAP for inviting me for this particular presentation. So today I'll be talking about the impact of physical activity or for physical and mental health during COVID-19 pandemic. So let me just share my screen with you. Okay. So the objectives of my presentation are, I will be highlighting the effect of COVID-19 on different systems of the body. I will be addressing the benefits and disadvantages associated with physical activity or inactivity, to recommend some practical strategies to mitigate the potential damage and the role of physiotherapist, and I would also be making a mention about WHO guidelines regarding physical activity during pandemic phase. So as we all know that this COVID-19 pandemic, which is caused by SARS coronavirus 2, has resulted into a major devastation to the entire society, not only in terms of health, but also economy and change in lifestyle, right? And we all know that it majorly affects the respiratory system of the body, but in certain cases, like people with some comorbid condition, some underlying pathological condition, there can be involvement of multiple organs as well, leading to systemic illness, and which can be a reason for death as well. And this is really unfortunate. And till date we know that there is such no effective interventional medicine available for COVID-19. So it is very important for all of us to adopt all sorts of measures, including physical activity, to protect us from catching this virus. Talking about public health recommendations, there have been guidelines, advisories issued by health agencies like WHO, CDSE, wherein they have recommended people to stay indoors. In fact, there was a lockdown also which was imposed by the government, and it extended for a long duration of time. So people remained indoors because of these guidelines and advisories which were issued so as to prevent the spread of the infection. But this actually unfortunately resulted into reduced level of physical activity among the individuals, and physical activity or exercise is important for physical and mental health, and reduction in the physical activity levels can downregulate the ability of the organ systems, to specifically the immune system, to resist viral infection, and it also increases the risk of damage to immune, respiratory and cardiovascular systems of our body, right? And unfortunately, our modern lifestyle today, which is promoting physical inactivity and sedentariness, and this is intensified by the social distancing and self-imposed or government-mandated quarantine measures which I just mentioned, and these measures are actually intended to reduce COVID-19 spread. So, disruption of physical activity and exercise routines have reduced physical fitness, and this can, increase the susceptibility to infection, and certainly increase some comorbidities which are associated with poor COVID-19 outcomes. And the current practical advice, it dictates that people, they should follow social distancing and hygiene practices. But I, as physiotherapists and all the physiotherapists across the globe, we propose that exercise can be safely incorporated. But exercising is, does not mean that it will protect us from catching this virus, but definitely this will, boost immune function of our body and prevent the decline of the immunological and the cardiometabolic functions of the body, which can make us more susceptible to catch this virus. In wake of current situation, there are various benefits of physical activity pertinent to COVID-19. It enhances immune functioning of the body, reduces inflammation, and also reduces the severity of various infections, including that of viral infection. Physical activity improves certain common chronic conditions such as diabetes, hypertension. It also, it's a great tool for managing symptoms like anxiety and depression. Physical activity also helps in bringing cortisol levels in balance, thereby controlling inflammation and infection in the body. So, talking about some other benefits of physical activity, it reduces blood pressure, it helps in weight management, it reduces the risk of heart disease, stroke, cancer, it improves fitness, mental health and fitness, also reduces the risk of depression and anxieties. So there are numerous positive health benefits of physical activity. So it's important that all of us should do one or other sort of activity during this pandemic phase, rather spending a lot of time in front of laptops and mobile phones, which increases the sedentary behavior. So this reduced physical activity levels during corona pandemic, I just mentioned various reasons for this, like quarantine, isolation, or fear of going out, that we might get infection. So the several reasons are there which have resulted into reduced physical activity levels during corona pandemic. So there was a research, which mentioned that just a 2-week reduction of physical activity can have an effect on multiple systems, physiological functions of our body. Like it can lead to multiple organ insulin insensitivity, and it can also alter lipid metabolism, increase central and visceral obesity, and also affect the cardiovascular fitness in healthy individuals. So there was a research which was published in European Journal of Sports Science, which studied the impact of sedentarism due to COVID-19 home confinement on the health of individuals. So sedentarism is when we are not doing sufficient amount of physical activity and spending a lot of time lying, sitting, and spending time in front of laptops, mobile phones. So the findings of this research stated that there was involvement of multiple organs, and people with pre-existing pathological conditions or comorbid conditions were a major reason for premature death and morbidities, and the immobilization resulted into down-regulation of ability of systems of the body to ward infection. And they also recommended that daily exercise can help combat the disease by boosting immune functioning of the body and counteracting some of the comorbidities. So there was a research by University College London which launched a social study on the psychological and social experience of people in the United Kingdom during COVID-19 pandemic. The research was done on 47,000 participants, and it had some very shocking findings. The research reported that 1 out of 4 people say that they have never done any exercise in last 7 days, and 85% of the participants reported did not engaging in even the moderate or strenuous exercises at all. 40% of the study participants had not done any gentle exercise, such as even going for a simple walk. And people with younger participants, 18 to 30 years, 4 out of 5 people reported not engaging in any moderate or high intensity activity. So see, these are some of the shocking findings of this research. And physical inactivity can land us into some chronic conditions which may become difficult to tackle later on. And here we see, if we look at this slide, this shows a comparison between, if we maintain our physical activity level and reduced physical activity behavior or sedentary behavior. So maintaining or increasing physical activity level can actually help in controlling disease and the symptoms. It can control cardiovascular risk profile, it can improve our functional status and attenuate symptoms of mental distress and improve overall quality of life as compared to people who maintain sedentary behavior. They have a reduced functionality, increased cardiovascular risk profile, they have worse disease activity and symptoms, and reduced quality of life. So if we talk about a little bit about the pathology of COVID-19, we all know that it is the respiratory system is majorly involved, and this virus mainly affects the alveoli where the gas exchange process happens. And if these alveoli they become collapsed, they damage, the gas exchange process will be affected and patient land into ventilator insufficient ventilation. Okay, so there are 2 types of cells which are present in our alveoli, type 1 and type 2 cells, and this is where the gas exchange takes place between alveoli and the capillaries. Now type 1 cells are responsible for gas exchange, and the type 2 cells are responsible for secreting surfactant molecule which prevents collapse of the alveoli. And it is the type 2 cells which are chiefly affected by this coronavirus, which by means of its spikes, once it attaches to the alveoli and injects its virus into it, injects the RNA and replicates inside, it damages the alveoli, damages the type 2 cells, collapses the alveoli. Here you can see there is collection of edematous fluid and collapse of alveoli, which results into insufficient ventilation, and the patients might land into respiratory distress as well. And this is one of the very interesting slides. It shows how people with metabolic syndrome, they get affected with COVID-19, this viral infection. And metabolic syndrome is a cluster of conditions which make individuals more susceptible to develop disease like heart disease, diabetes, type 2 diabetes. So have a look at this slide, that the inflammation which is caused by viral infection, this can cause multi-organ damage including myocarditis and heart attack, and the cytokine storm and the activation of the coagulation system causes excessive clotting. Muscle hypoxia, inflammation, electrolyte imbalances and metabolic disturbances can result into rhabdomyolysis. And the direct infection by virus, hypoxia, inflammation and low blood pressure can cause acute kidney injuries. So see how multiple organs of the body besides the pulmonary system, which I just mentioned, the type 2 cells damage causing collapse of the alveoli is also there, in patients with corona. Talking about COVID-19 and immune system, I just mentioned, that exercising or physical activity prevents a decline in the immunological functions of the body. There have been certain animal experiments which mentioned that administering influenza and herpes simplex virus in the respiratory tract with the help of just a second have shown that moderate exercises performed before or after infection improves morbidity and mortality to the infection. And there have been certain preclinical studies which have shown that high intensity exercises, they are not good. They cause a decline, the acute responses decline in the immune function of the body. And there was one inverted J theory which suggested that after a bout of moderate intensity exercise, the enzyme salivary leptophenin it remains elevated in the body, and this enzyme is responsible. This prevents RNA and DNA viruses from infecting the cell by binding to the receptor sites. So, and also, when we exercise, there is a lot of movement of the leukocytes in the body, which suggests increased immunosurveillance against pathogens, including viruses, once we do moderate intensity exercises. So, recommendation is moderate intensity exercises routinely done can prevent viruses, DNA and RNA viruses from infecting the body, infecting the cells. Now, talking about the effect on respiratory system, we just talked about the alveoli, the damage to the alveoli it causes. There is another condition, VIDD, ventilator-induced diaphragm dysfunction, which is clinically significant because there are some people who land into respiratory failure and they need support of mechanical ventilation as a resort to save their life. And it becomes, over a period of time when they are on ventilator, their diaphragm muscle, it goes into deconditioning, it becomes weak. So weaning the patient from the ventilator, it becomes difficult, and this condition is known as VIDD, ventilator-induced diaphragm dysfunction, and many patients even require prolonged time on the ventilator that increase weaning problems. And researchers report that endurance-trained individuals that report COVID-19 and require ventilator support will benefit from exercise-induced preconditioning of the diaphragm. And studies have found that proteins that contribute to protection of the diaphragm against VIDD, they reveal that exercise-induced changes in mitochondrial proteins and cytosolic proteins, they contribute to exercise preconditioning of the diaphragm. Now, talking about the effects on cardiorespiratory system, there can be some short and long-term effects of COVID on cardiorespiratory system. It can lead to myocarditis, myocardial infarction, and cardiac arrhythmias, even cardiac death. So, here physical activity, is critical. Physical activity, we know that it is important for good functioning of the cardiovascular system, and in fact I would say that physical inactivity is believed to be one of the major risk factors for health issues, morbidities and mortalities related to cardiac system. So it is critical, it is important for cardiovascular health, especially during this pandemic phase. Okay, and with both heart and peripheral muscles, as we know, they are infected by the virus, and heart muscle has got both long-term and short-term consequences, which I just mentioned, ranging from myocarditis to even cardiac arrest. So, researchers have reported that exercise-induced cardiac and circulating nitrous oxide increase protect against ischemia and reperfusion injury. And there have been evidences that suggest that nitrous oxide, it contributes to cardiac and metabolic adaptations to exercise, thereby increasing the mitochondrial biogenesis. And there have been reports which indicate that regular physical activity can induce angiogenesis as well, resulting because of the upregulation of the pro-angiogenic factors, particularly the vascular endothelial growth factor. So such are the benefits of physical activity on the cardiovascular functioning of the body. Talking about the impact of COVID-19 and physical activity on musculoskeletal system, just like cardiovascular system, it is essential to maintain fitness of musculoskeletal system as well, in terms of musculoskeletal strength, flexibility, endurance, bone strength and all. Okay, and in skeletal muscle, physical inactivity can lead to reduced insulin sensitivity, contributing to distribution of energy substrate, and which can result into central fat accumulation, and there can be down regulation of mitochondrial function and lipoprotein metabolism during physical inactivity. And researchers have also stated that skeletal muscle adapts to prolonged physical inactivity by decreasing not only the muscle fiber size, muscle function, quality, and there is deterioration of mitochondrial homeostasis due to immobilization, muscle immobilization, which can lead to organic and systemic inflammation, which is an important mechanism for COVID-19 pathogenesis. Talking about musculoskeletal deconditioning, now this is very important, very much noted in people who are recovering from COVID, coming out of quarantine after a long period of immobilization, 14 to 17 days, and they've not done a sufficient amount of physical activity which is needed for maintaining optimal health. So musculoskeletal deconditioning is reduced muscular strength, endurance and fatigue while performing day-to-day activities, and this is more seen in, this is more observed in people with some underlying health conditions, or in elderly people, and in fit and healthy people this will be less noticeable. But then this thing should be taken care of, musculoskeletal deconditioning, which happens after a long period of physical inactivity, and this can have implications for health and social care services which are already under stress. Mental health during corona. Now this is very important because physical inactivity, corona has actually resulted into profound effect on the mental health of individuals, and there are various factors which have affected mental health of people during pandemic and resulted into anxieties and depression, right from lack of infectious disease knowledge to lack of health behavior, good eating habits and physical activity behavior, and economic health issues, financial issues, disturbance in the sleep pattern, and facing great changes and adaptability, and the impact of social media, quarantine. This all has affected the mental health of individuals during COVID-19 pandemic, resulting into anxiety, depression, and has created a lot of stress. And various researches have been conducted on mental health as well. Research stated that psychological stress of remaining in a confined space can cause endocrinal changes, which in turn can affect immune status and can have a negative effect on the psychological status of the individuals. And they also mentioned that a short confinement of 7 to 10 days can affect the mental health significantly, causing the markers of lymphocyte expression and to be reduced, and alteration in the natural killer cell profile. So immune function, mental health, they all get affected if we are not exercising and we are confined to a particular space because of these endocrinal changes that they happen. They can affect our psychological health. Now there was a study which was done on the impact of physical activity on psychological health during COVID-19 pandemic in Italy. They found that there is a positive relationship between physical activity and mental well-being of individuals, and they recommended that based on this scientific evidence, a regular exercise routine is a key strategy for physical and mental health during a forced rest period like the current coronavirus emergency. And the simplest mean for reducing the psychological stress of confinement is regular physical activity, and the data from this study also concluded that those responsible for both the intensity and duration of exercise show large benefits to mental health, thereby reducing depression and feeling of anxiety and feeling of anger and various other mental health symptoms. So these are some of the health benefits of physical activity on mental health. Like it helps in reducing stress level, increase energy levels, reduce depression and increase well-being. It improves our mood, reduce anxiety, improves our self-esteem. So various health benefits are there of physical activity on mental health. Talking about the effect on sleep. Now sleep nowadays is very much affected. People are experiencing lack of sleep, maybe because of the change in the sleeping schedule. Entire lifestyle has changed, and sleep is important not only for physical health but for the mental health of individuals, for the functioning of the immune system of the body as well. So it is paramount during COVID-19 pandemic because of its vast benefits for physical and mental health, and it has been linked to mental health issues, physical health issues related to stress and anxiety. It's also one of the occupational health hazards, specifically in context of frontline workers. And there is a bidirectional link between sleep and immune system. The research stated that people who are getting poor sleep, the working of the immune system of the body is affected, and they are more prone to get infections like COVID-19. Talking about physical activity recommendations. Now, during pandemic, unfortunately, we just mentioned that our modern lifestyle, it has promoted physical inactivity and sedentariness. Okay, sedentariness, I have explained that it is when we are not doing a good amount of physical activity and spending a lot of time sitting, lying in front of computer and laptops. So all this has resulted into poor lifestyle. On top of that, social distancing and self-imposed or government-mandated quarantine measures to contain the spread of infection, all this has resulted into a decline in physical activity level, a change in lifestyle, which can actually pose significant challenges for us to remain physically active. So many researches have been done which promote physical activity during COVID pandemic phase, and they are published in some very high-end journals, like one in Science Direct and the other in Frontiers. And so there's one research published in Sports Medicine and Health Science Journal. All these researchers have recommended that we should keep our physical activity levels up more than ever during this pandemic phase, and just not let our physical fitness levels go down. So here comes the role of physiotherapists. We as movement experts can really create awareness about the importance of physical activity among people during this pandemic phase, and we can also suggest different sort of exercises, different combination of exercises as per WHO guidelines, which can be done at home, or if we are doing exercises outside, what are the precautions that should be taken if we exercise outdoors. So physiotherapists can they can help to regain muscle strength, regain joint range, optimize well-being, prevent the decline in the musculoskeletal and the cardiovascular functions. They can also prevent the deconditioning, which I just mentioned a few minutes back. So we can work as active, and physiotherapists during lockdown can be active and effective as a global workforce through supporting people to stay physically active. Now these are the WHO recommendations regarding physical activity. They have recommended that people should remain active. They should cut down their periods of sitting and take frequent active breaks. Okay, and physiotherapists can really play a significant role in this. We can encourage people to break periods of inactivity, which I just mentioned, and encourage people to do combination of exercises like aerobic exercises, strengthening exercises, stretching exercises. Okay, for aerobics, the stairs are available at home. We can climbing stairs up and down twice or thrice a day can be really good for boosting our stamina. Do skipping or even walking around the house, or for strengthening exercises. If we don't have weight cuffs or dumbbells at home, we can make use of water bottles, cans or jars. And there are certain exercises which utilize body weight as a source of resistance, like sit-ups and planks and lunges. These can be done at home for performing strengthening exercises. So we can find different ways. Physiotherapists can suggest different ways of doing different sort of exercises with the limited resources we have and within the limited space. Okay, so physiotherapists really can play a crucial role in this, and these are some of the WHO recommendations. They have recommended that people of all the age group, right from an infant to a person more than 65 years of age group, they should perform moderate to high intensity exercises throughout the day, and with a minimum of 30-minute exercise per day, and that should be a combination of different exercises which I just mentioned: strengthening exercises, stretching exercises, breathing exercises. We can also include yoga and meditation into our daily routine, but minimum at least 30-minute exercises should be done for maintaining our physical and mental health. So this is WHO recommendation mentioned on their website. Keep ourselves active. We should keep ourselves physically active, healthy, even when we are at home, and doing any activity around the home is better than doing nothing. Okay, then certain steps they've recommended: walking up and down stairs, doing some stretching exercises, doing aerobics, yoga, dance with whatever resources we have at home. We can also utilize the online resources for keeping ourselves physically active. Some online classes on aerobic exercises or yoga exercises, and these are the WHO recommendations for performing different exercises. They have recommended aerobics, strengthening exercises, and if we are performing outdoor exercises or activities, so we should take all measures, all precautions that maintaining a distance of 6 feet away from others, all precautions from spreading the infection, catching the infection. So outdoor activities like jogging, walking, or a bicycle riding, all the exercises are possible. Some frequently asked questions regarding physical activity: will exercise help in protecting from virus? Okay, so I would say no. Exercise cannot protect us from catching this infection. Even the healthiest individual can get this virus, but it does help in promoting our physical and mental health and preventing a decline in the immunological function and the cardiometabolic functions of the body. And if at all we get this virus, the chances of recovery would be better, they would be quicker, and the complications that develop with this viral infection would be less. So we should keep ourselves physically active even during this quarantine phase by doing all sort of activities. But yes, it is very important that precautions should be taken when we are exercising, and precautions as in when you exercise, make sure that you sanitize the surface, sanitize the equipment which you use before and after. Keep monitoring your oxygen saturation level with the help of pulse oximeter, which is easily available in the market, and do all sort of combination of exercises. Take frequent breaks from rest period. So all sort of precautions should be taken. Maintain a distance of 6 feet. So these are very important. And regarding face masks, there have been two different theories. Some researchers, some reports, they say that face masks can be easily worn during exercise, but the symptoms should be monitored. If at all we feel symptoms like difficulty in breathing and all, so we should immediately stop the exercise till the symptoms subside. And for people with comorbid condition, definitely they should consult their physician before they embark on an exercise program. And if you are exercising, if you are an exercise freak, so you should keep a couple of masks available with you, so that if one gets wet, you can replace it with the other one, and preferably use a cloth mask, fabric based mask. And some reports say that we should not exercise with face mask on, because it promotes growth of bacteria and also makes breathing difficult. So choice is yours, so how comfortable you feel, but all sort of precautions should be taken. All recommendations and guidelines, advisories which are being issued by the government should be taken care of regarding the hand hygiene, and removing the face mask correctly and all. Okay. So to conclude, I would say that as we wait for anti-COVID-19 vaccine or the most promising treatment for the new coronavirus, regular and structured physical activity could be a complementary preventive intervention which is aimed at positively modulating immune response, thus reducing the negative impact of comorbidities in COVID-19 infection. So identifying intervention measures would be of major importance in containing the spread of the virus, given that it does not seem that pandemic will be brought under control in near future. So physical activity can be taken as one of the complementary preventive intervention which can help us in improving the physical and the mental health of the individuals during corona pandemic and modulating the immune functions of the body. So these are some of my references, and in the end I would say stay safe, stay healthy, and keep doing physical activity and exercises. Thank you so much.